Brooke. Hi, I'm Dr. Randy. You doing okay today?
Mm-hmm.
Are you? Got any fun plans for the summer?
Mm-hmm.
Do you? What are you going to do?
Gonna go to the beach and I'm gonna go to camp.
You're going to go to camp. Well, do you know what we're doing today?
No.
Okay, well, you have a few little cavities in your mouth, okay? What we're going to do is we're gonna remove the cavity bugs, okay? And then after we remove those cavity bugs, then we're going to fill those little areas that we remove the cavity bugs with some little silver soldiers, okay? And then those will help you fight off those cavity bugs so you don't get them as bad again, okay? Do you have any questions about anything?
No.
Okay. Well, it's okay if we get started? Okay. All right. Well, have fun. All right?
Yeah, you bet.
All right. We're going to go ahead and get started, okay? Get your head back for me, sweetheart. There you go.
Doctor, look at her. What's she doing? Should we get some help? What should we do? What?
Brooke,
Oh my God.
Brooke,
What is wrong with her?
Brooke, Brooke,
What?
Brooke.
Oh, she quit. She quit. Thank God.
Brooke.
Oh
Brooke.
my God, there she goes.
Brooke.
Do you want me to do it? Do I
Call
need to do something?
911. Call 911. Call 911. Brooke. 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 Brooke.
They're on their way.
My God, Brooke!
Brooke.
Brooke! What's wrong with her?
Brooke.
What's wrong? Is she breathing? Brooke! Oh, Brooke! Brooke! What's wrong with her? What's wrong? Brooke, what do you mean? How do you know she's gonna be okay? Can't you do something? Brooke! 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 She's not breathing. She's not breathing. Did something happen? What happened before I came in? Is she unconscious? Is she sedated? Brooke! Brooke! Is she sedated? Is she gonna be okay? How long will it take them to get here?
They're on their way.
Brooke! Brooke, try to do something to help her, please. Brooke! Brooke! What are you gonna do? What are you gonna do? She's not breathing, but she's not breathing. How's she gonna be okay if she's not breathing? Brooke! Brooke, you have to wait. Brooke! Brooke! Oh my baby! What happened? Has this ever happened before? What did you do in a situation?
Here they come. Here they come. Get out of the way.
Brooke, you have to wake up.
There they
Brooke.
are. There they are. Come, get out of the way. Get out of the way. Get out of the way.
My baby! My baby, you have to help her. She's not breathing.
Get out of the way.
She's not breathing. Brooke, her name is Brooke.
Yeah, just have-
Please help her.
Can you hear me?
Is she breathing?
She's not breathing. She's not.
You got to get out of the way so they can do their job.
Please help her. Brooke.
Let's get some oxygen on her. Let's get her.
She's not breathing.
Get the monitor
She's
on her.
not breathing. Brooke. Oh, my baby. Please help my baby. Brooke, you have to wake
Does she have any
up.
medical problems that we know
Brooke,
about?
please wake up.
Okay.
Please help my
Go ahead
baby.
and breathe for her.
Okay, stop. You don't get a chance to save a life you've lost. So get it right the first time.
You know, her whole in the back of my sister.
You have any questions about anything?
No.
Okay. Well, it's okay if we get started.
Local anesthetics are the safest and the most effective drugs in all of medicine for the prevention and management of pain. They reversibly block nerve conduction, permitting dental and surgical procedures to be performed painlessly. However, as you've just witnessed, the administration of too much local anesthetic, combined with ineffective management of the resulting emergency, may lead to an irreversible problem, the death of a patient. Typically, local anesthetic overdose develops as a result of several errors, which when combined result in a serious situation like the one we just saw. These include, number 1, the wrong treatment plan. 4 quadrants of dentistry in one visit with local anesthesia alone. With the rare exception, the pediatric dentist will not treat younger children in all 4 quadrants in one dental visit. Number 2, the wrong choice of local anesthetic. Most non-pediatric dentists treating little children prefer to use a short-acting drug, such as 3% mepivacaine, so that there is little residual soft tissue anesthesia when the patient leaves the office. Yet the pediatric dentist treating young children in more than one quadrant will use a local anesthetic which contains a vasoconstrictor such as epinephrine. Number 3, administering local anesthetic to all 4 quadrants at one time. And number 4, the administration of full cartridges, 1.8 mLs of local anesthetic for each injection. A fraction of a cartridge is needed for successful pain control in younger children. Now, let's take a look again at the scenario where local anesthetic overdose occurs as a result of administration of too much local anesthetic. However, in this instance, the doctor and staff are well prepared to recognize and to manage the situation. The local anesthetic blood level reaches its seizure threshold approximately 5 minutes after the injections have been administered. The blood level of local anesthetic will then decrease rapidly as the drug is redistributed. A typical local anesthetic-induced seizure will last for less than 1 minute.
What's going on?
Maintenance of a patent airway and oxygenation of the patient in the post-seizure period is of paramount importance in preventing a recurrence of the seizure and in providing a successful outcome to the situation.
Brooke? What happened?
She's going to be okay, Mom.
What happened to her?
So she's
Can you
doing
hear
okay.
me, Brooke?
Thank you. Thank
you
you.
hear me?
Can I get you some?
Hey.
Nothing. We're okay. Thank you.
In a local anesthetic overdose in which the airway is not properly maintained after the seizure ends, the patient is not getting oxygen into their blood, they become hypoxic, and is not getting carbon dioxide out, they become hypercarbic. This combination leads to a lowering of the seizure threshold for the local anesthetic, and after about 2 to 3 minutes, a second seizure, more intense and of longer duration, occurs as the blood level of the local anesthetic once again exceeds its now lower seizure threshold. The bottom line is, in the absence of proper management in the post-seizure period, carbon dioxide levels increase while oxygen levels decrease, leading to a drop in the seizure threshold for the local anesthetic drug and to a second, more severe and longer-lasting seizure. Another important scenario involves the administration of oral sedative drugs. These are usually administered to the patient by a member of the dental office staff approximately 1 hour prior to the start of the dental procedure.
Problems in your mouth make things all better.
Okay.
So all you have to do is drink this.
Okay.
Tastes good. And just don't spill it on yourself.
Sure.
Does that sound all right?
Sure.
Tastes good, huh? Okay. Well, just relax, sweetie pie.
The patient should be kept under constant supervision and observation during this period.
Scary sleeping. Yeah. That's good. I'll get the back of his head if you want to put him down.
Sure.
There you go. You can
follow us back here?
Sure.
Thank you.
Once the patient is placed in the dental chair, monitors must be applied. The pulse oximeter provides continuous monitoring of the patient's respiratory status and level of oxygenation. Here, the doctor is well prepared and manages the situation properly when the low pulse oximeter alarm goes off, alerting her to a potential problem, respiratory depression.
He's not breathing. Can I have the oxygen, please?
Let's check.
Thanks.
Local anesthetics for pain control and CNS depressants for the management of fear are important components of contemporary dentistry. Whenever drugs are used, even when everything is done correctly, there is a potential for adverse events to develop. Being prepared to recognize and to efficiently manage these events will lead to a successful outcome.